Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Sajid Majid, consultant child specialist. Today I will discuss an important short case of chest examination. First of all, introduce yourself, then take informed consent. Rub your hand if outside is cold. Then make position of the patient. Head should be straight, arm should side, and legs should be straight. Whole body should be in one plane. Patient should be in panties or exposure should be from mid chest to mid thigh. In chest examination, always do comparison of both sides. Ask for any pain over chest area before examination and think of two differential diagnoses in short case of chest like pleural effusion or consolidation and less likely asthma. Now do inspection of the child. Inspection should be from foot end and side end. Take respiratory rate and look for any deformity. There would be localized bulge in case of pleural effusion but not in case of consolidation. Chest movement will be decreased both in case of pleural effusion and consolidation. During palpation, localize apex beat. It would be in 4 or 5th intercostal space. Then palpate for trachea. In case of pleural effusion, it would always be away from affected side, and in case of consolidation, trachea would be pulled towards the consolidation. Chest expansion will be decreased both in case of pleural effusion and consolidation. Vocal fremitus would be decreased in case of pleural effusion while it will be increased in case of consolidation. It can be done by placing ulnar border of the hand in intercostal spaces. Then do percussion. The method of percussion is use pleximeter of left hand and plexor of right hand. Plexor should strike pleximeter at 90 degree. Movement should be on the wrist joint, not on the elbow joint. Hand, elbow, and wrist are should be in same plane. Percussion should be done 3 intercostal spaces medially and 4 intercostal spaces laterally. Do percussion by comparing both sides. And same way from the back, do percussion of the apices and clavicle first, then do 3 intercostal spaces medially and 4 intercostal spaces laterally by comparing both sides. Percussion note would be stony dull in case of pleural effusion, while it would be dull in case of consolidation. Then do auscultation. Airway entry will be decreased both in case of pleural effusion and consolidation. Vocal resonance will be decreased in case of pleural effusion while it would be increased in case of consolidation. Then do back examination same ways like inspection for any bulge, palpation for tenderness, vocal fremitus and chest expansion, percussion for dullness, auscultation for air entry and vocal resonance. Then do the general physical examination. Start from hand for pillar, clubbing, check BCG scar and all group of lymph nodes. Then take temperature of the patient, do height and weight, cover the patient and say thanks to the patient. Then give brief and comprehensive description like a 7-year-old child lying down on a couch with no obvious respiratory distress with respiratory rate of 20 per minute and pulse rate of 120 per minute. Patient is afebrile to touch. There is no obvious chest bulge, no deformity, apex beat in fourth intercostal space and trachea is pulled toward the left side. My findings are consistent with left side of the chest. There is decreased chest movement on the left side with increased vocal fremitus and vocal resonance. Percussion note is dull with bronchial breathing on left lower side of the chest anteriorly, laterally and posteriorly. Rest of the examination is normal as there is no clubbing, no pallor with normal BCG scar. There is no lymphadenopathy or sign of failure was observed. Sir, patient having height of 115 centimeter and weight of 22 centimeter, which seem to be appropriate for the age. But I want to plot on the centile chart. Sir, on the basis of my examination, my differential are consolidation secondary to pneumonia, consolidation collapse secondary to tuberculosis, collapse with patent bronchus of the lung. Now just give list of investigation like blood complete picture with ESR, blood culture, sputum AFB, Manto test, chest X-ray, ultrasound chest and CT scan chest with aspiration.